Good evening. I am Dr. S. Vijayalekshmi, consultant neurologist, Pushpagiri Medical College Hospital, Tiruvalla. Today, I'll be talking about the topic once epilepsy is diagnosed, what precautions you need to take. First of all, you should understand that epilepsy is not contagious. You cannot catch it or you cannot spread it. So don't be afraid of epilepsy. But seizures itself, by their nature, can pose problems. So we have to be careful. We have to follow certain steps to reduce the risk of seizures. First of all, you should get the proper diagnosis of epilepsy. Second, working with your doctor, you should form a perfect treatment plan for you. Third, you should always have a follow up visit with your doctor. If your seizures are not getting controlled, you should consult a neurologist and should get the evaluation done and should have diagnosed and should adjust all the medications. So, this is the first and foremost thing which you have to do. There are people who get seizures during sleep. They have to be extra careful because they have to keep sleep monitors as well as sleep alarms. Now, seizures can occur de novo, but many times there are many triggers for seizures. So you should know the triggers, reduce them or avoid them. Triggers like fever, infections, sleeplessness, lack of food, missed medications, all these are triggers. So you should understand your triggers. Each person will be getting different type of triggers. You should understand it, reduce it, or you should avoid it as far as possible. Thirdly, follow-up checkups are very important. Monthly or bi-monthly, as per the advice of your neurologist, you should get your checkup done and the medications titrated. Every anti-seizure medication will have some side effects, but all these side effects will not occur to a particular person. Some people may be getting some side effects. It is according to their nature. So, any side effect which you notice after starting the medication, you should write it down and you should discuss with your doctor. Your doctor may be able to switch over the medication or reduce the dose. That is also very important. Nextly, women with pregnancy. We are very much concerned about women. Women who are planning pregnancy, who are pregnant, who are after childbirth. This group has to be dealt with utmost care because many medications are teratogenic. So, before planning pregnancy, you should tell your doctor that you are planning pregnancy so that your doctor can reduce the dose or change the medication. Likewise, during pregnancy and immediately after childbirth, also, you should consult the doctor and adjust the medications according to the individual risk as well as according to our condition. That is also at most important. Next important question which comes to us is like that, can I drive, doctor? That's a very important question. People with seizure, they are always at a risk of driving. So the basic consensus is that if a person is seizure free for about 6 months, he or she can drive if he or she is adherent to the medication. Before driving, you should get the opinion of your doctor and confirm that you can drive. Similar is the case with swimming also. So, by taking care of all these factors, that is, getting the correct diagnosis, getting the correct checkup, making the correct dose of the medications, correct follow up, likewise, careful while driving, swimming, also, all the unwanted side effects you notice and tell to the doctor and adjust. Likewise, if you are doing this, people with epilepsy can also enjoy a life which is hassle free. Thank you.